My favorite injury to work with is frozen shoulder. People come in and they're dying in pain. They can't lie on it, they can't move, they can't get dressed. It's incredibly painful. You treat them for 3 or 4 weeks and they can do everything. It's not all gone yet, but they feel incredibly better and they want to just kiss your feet because they're so happy. So here are the things to keep in mind. 1, there are 3 stages to frozen shoulder. First, there's a freezing stage. Then there's the frozen stage. Then there's the thawing stage. Each one accounts for 3 to 4 months. So 9 to 12 months for the whole thing if you do nothing. 2, there is massive scar tissue inside the joint, and that's what you're working on. The person can't comb their hair, they can't reach into their back pocket, they can't just get dressed. It's just awful pain. 3, the most important test is lateral rotation, just passive lateral rotation. They cannot take their arm out to the side. And that's going to be really, really limited. They can barely move it without a lot of pain. They just have to move it a little bit, and that's the major, major sign of a frozen shoulder. 4, it can be treated most effectively if you combine your efforts with a doctor in the first and second trimester, those first and second stages. They get an injection of an anti-inflammatory, and then you see them within 3 hours, and you can accomplish 50% of the treatment in that one session because they've been anesthetized and the joint has been de-inflamed temporarily. And so that's the time to work with them. Number 5, resisted stretching is the way to help the person get rid of that scar tissue. Now, what you do is you take the person to the end of the range they can go to, which is usually here. You have them push with a lot of force, and what they're doing is they are tearing the scar tissue, and it pops little scar tissues, and they can feel some relief as you do it. And so it's a very particular kind of stretching that gets rid of the scar tissue. Just doing the injection alone often doesn't work because they didn't get rid of everything. You've got to get rid of all the scar tissue for the person to really recover. And you do this in 3 or 4 different positions. The goal is to bring back full range of motion. And again, it's the most satisfying treatment because the person just is so relieved, so happy that they have found somebody that could actually help them and they could live a life that's not full of pain. So if you want to learn this, you can sign up for our Anatomy in Action subscription service, and you can learn about the shoulder and 9 other modules on every other part of the body. You learn how to assess and treat all those injuries successfully. All you need to do is press on the link to take you to subscribe.